Active heel slides, now we're getting the leg to do a little bit more actively, which is going to further and reinforce the control, a bit of endurance, and some strength in the leg during the earlier phase of the rehab to help prevent disuse atrophy, minimize any stiffness as well, and also help promote circulation and manage any inflammation. So to perform, we're going to be laying down with the legs straight. Now what I'm going to do is drive that heel back towards me, sliding the foot on the surface, make sure it can slide. So doing this in a bed on a wood or towel surface is optimal. And what I'm going to do is each rep, I'm trying to go a little further in the range of motion, really focused on recruiting this hamstring, the back of my leg, to perform this movement. And then nice and slow lower through the full arc of motion, getting my knee fully straight, and then bending a little further each rep. Hold for about a 3 to 5 second pause at the top, and then return to the starting position. And again, with each rep, try to go a little further to restore range of motion, go into tolerance, keep the pain controlled.